Assalamu alaikum everyone. I am Dr. Maimona. Today we are going to discuss lymphatic organs and tissues that are present in our body. So first of all, we will discuss the lymph nodes. Lymph nodes are oval shaped organs, and these oval shaped organs are present along the lymph vessels. As the lymph passes through the lymphatic vessels, it has to pass through 8 to 10 nodes before returning to the blood. So, lymph has to pass through these lymph nodes. The structure of the lymph node: 4 to 5 lymph vessels enter a lymph node, and these entering vessels are known as efferent vessels, efferent lymphatic vessels, and only one vessel leaves the lymph node, which carries the lymph away from the node, and the lymphatic vessel which leaves the lymph node is known as efferent lymphatic vessel. And each node it has a concave surface that is called the hilum, and it is the area. Hilum is an area where an artery enters and vein and lymphatic vessel leaves the lymph node. So in this diagram we can see on the left side we can see the efferent lymph vessels, 2 to 3. In this diagram we have 3 efferent lymph vessels. Efferent lymph vessels are the vessels which takes the lymph towards the lymph node, or which takes the lymph into the lymph node. So these lymph vessels, efferent lymph vessels, they carries the lymph into the lymph node. And on the right side there is a hilum, and which is a depressed area. At this hilum, or depressed area, or just like a concave surface, at this hilum we can see an efferent lymph vessel. Now from this efferent lymph vessel, lymph is moving out of the lymph node again into the lymphatic vessel. All the lymph nodes of the body, they are arranged into 2 groups. They are situated superficially in the body as well as in the deep tissues. So we have 2 types of lymph nodes: deep lymph nodes and superficial lymph nodes. Now, what are the examples of these lymph nodes? Lymph from the head and neck, it passes through the deep and superficial cervical nodes. These cervical nodes are present in the neck, superficially as well as deep tissues. Lymph from the upper limbs, it passes through the deep as well as superficial axillary nodes. These axillary nodes are present in the axilla. Lymph from the breast, it also drains into the axillary nodes. Lymph from the pelvis and abdomen, it passes through many lymph nodes and then drains into cisterna chyli. Cisterna chyli is basically a dilated tube which collects all the lymph coming from the pelvis as well as abdomen. The abdominal and pelvic lymph nodes are present near the blood vessels. For example, the aorta and the external and internal iliac vessels. Lymph from the lower limbs drains into the deep and superficial lymph nodes, inguinal lymph nodes. Now coming towards the function of lymph nodes. The first function is filtration and phagocytosis. So all the lymph, when it passes through the lymph nodes, it undergoes filtration. When the lymph contains bacteria, cancer cells, old and damaged cells, they are also filtered by the lymph nodes and then destroyed by the macrophages and antibodies which are present in the lymph nodes. So phagocytosis also occurs in the lymph nodes. Particles which cannot be destroyed, they remain within the macrophages. When phagocytosis is incomplete, they can stimulate the inflammation of the lymph node, and this inflammation can cause enlargement of the lymph node. This enlargement is called lymphadenopathy. So in various infections we can see the enlarged lymph nodes, and we can palpate these lymph nodes. Second function is proliferation of lymphocytes. So lymph nodes are also the area where T and B lymphocytes, they get activated and they multiply. Proliferation means multiplication. Increase in number of the T and B lymphocytes also occurs in the lymph nodes. Antibodies are being produced by the sensitized B lymphocytes. So here we have a diagram of the lymph node, and in this lymph node we have lymphocytes, macrophages and reticulocytes. रेटिक्यूलोसाइट्स क्या है? ये आरबीसीज की प्री मैच्योर फॉर्म होती है, जो कि लिम्फ नोड में आपको इस डायग्राम में नज़र आ रही है. सो द सेकेंड ऑर्गन, वेरी इंपॉर्टेंट lymphoid organ, is spleen. Spleen is the largest lymphoid organ, and it contains reticular as well as lymphatic tissue. We can see in this diagram that at the upper end of the stomach, on the left side, we have spleen. Spleen is covered by a splenic capsule, and it is divided into red pulp as well as white pulp. Red pulp is made up of venous sinuses, and these venous sinuses contains blood. So that's why it is called red pulp. And white pulp is an area where we have lymphocytes and macrophages. So in white pulp we have WBCs, white blood cells. These are the lymphocytes and macrophages. So this area is known as white pulp. Functions of spleen, as phagocytosis is also the function of lymph node. So this phagocytosis is also one of the function of spleen. All the old and abnormal RBCs are being destroyed in the spleen. So hemolysis occurs in the spleen, and the breakdown products, that is bilirubin and iron, these are then transported into the liver through splenic vein. Old RBCs, platelets and bacteria, they are also phagocytosed in the spleen. So now the difference between spleen and lymph node is that spleen does not contain any lymphatics. So there are no lymphatics which enters into the spleen, and spleen is not exposed to any disease that spread by lymph. The next function is storage of blood. Spleen can store up to 350 ml of blood, and this storage function is very helpful in case of circulatory shock. For example, during hemorrhage, our body needs blood. So sympathetic stimulation causes constriction, vasoconstriction in the spleen, and this blood is then returned to the circulation. So very important function of spleen is storage of blood. Third function is immune response. So just like lymph nodes, spleen also contains T and B lymphocytes, which becomes activated in response to antigens. Lymphocyte proliferation during serious infection can cause enlargement of the spleen. So during infections in the body, we can see the splenomegaly. Splenomegaly means enlargement of the spleen during infections. Erythropoiesis. Erythropoiesis means production of RBCs, formation of RBCs. So during fetal life, our spleen has a major role in the production of RBCs. So spleen has a role in erythropoiesis. Next lymphoid tissue is the thymus gland. Thymus gland is present behind the sternum in the upper part of the mediastinum, and then from here it extends upwards into the root of the neck. It is present at birth, and then it grows until puberty. After puberty, it undergoes atrophy. It means from the birth up to the puberty, thymus is present in our body, but after puberty thymus gland जो है ये disappear हो जाता है because it undergoes atrophy. Now the functions of thymus gland. Again, in thymus we have B and T lymphocytes, but the premature forms of B and T lymphocytes are basically formed in the bone marrow. T lymphocytes, the premature forms of the T lymphocytes, they enter the thymus, and the activated T cells are being formed in the thymus. So thymus activates the T lymphocytes. It provides specificity to each T lymphocyte so that it can react only to one specific antigen, and also T lymphocytes can react against foreign tissue, not the self antigens. So this specificity to the T lymphocyte is also given to the T lymphocytes in the thymus. T lymphocytes then leaves the thymus and enters the blood and other lymphoid tissues. Thymosin is a hormone, and this hormone causes maturation of the thymus as well as other lymphoid tissue. Shrinkage of the gland begins in the adolescence, and with increasing age the effectiveness of the T lymphocyte response decreases against antigens. Now the next lymphoid tissue is MALT. MALT means mucosa associated lymphoid tissue. As its name indicates that MALT should be present in the mucosa of different organs in the body. And this type of lymphoid tissue is not enclosed within a capsule, just like spleen and thymus. They are enclosed in capsules. This MALT also contains the B and T lymphocyte, and so it can recognize or detect the antigens. This mucosa associated lymphoid tissue does not contain lymphatic vessels, so do not filter the lymph. Now the location of MALT is found in the GIT, in the respiratory tract, in the genitourinary tract, and in all the systems of the body that are exposed to external environment. Now the last lymphoid organ is the tonsil. Tonsils are basically located in the mouth and throat, and again tonsils contain T and B lymphocytes, so they can destroy all the inhaled antigens. So tonsils again they have function against antigens, so they provide immunity to the body. That was all about for today's lecture. Thank you very much.